to this morning's Family Caregiving webinar. My name is Carrie McClellan. I'm the Outreach Manager for ElderHelp, and I will be facilitating today's webinar, and I will introduce our guest speaker here in just a moment, but we are excited to have Tiffany joining us for today's topic. A little bit of housekeeping before we begin. We are going to ask that you submit questions through the question pane. So it might show up as question, it might show up as chat. Everybody's system works a little bit differently, but you're welcome to submit those throughout. We will go through the questions and answer those at the end of the presentation. So don't wait to ask your question. You're welcome to type that in throughout, and then we'll review those at the end. I have included a couple of links in the chat. So you received those through the reminder email, as well as a separate one I sent this morning, but that has the link for the downloadable workbook that we'll be going through during the presentation. So if you wanted to pull that up and follow along, Tiffany will reference certain sections in that throughout. So please do that if you would like. And we'll go ahead and get started. So before I introduce Tiffany and allow her to share her expertise with us all, I just wanted to briefly mention who ElderHelp is and why we do these webinars. So ElderHelp is a local nonprofit organization, and we support older adults and their desire to age in place in their own homes. And a lot of times that comes with family members who are looking for how they can be involved in that process and support their loved ones as well. So we provide direct services to older adults, and then we also connect family members with resources and support so that they can be part of that as well. We are celebrating over 49 years now of serving the San Diego community and beyond, and we're really excited about that and look forward to celebrating our 50th year very soon. Through ElderHelp, we have a set of core services. We offer information and referrals. So again, anybody can call us and look for resources. We are happy to try to point you in the right direction, whether it's a program that might be through ElderHelp or another community organization. We're always happy to try to connect those dots. We offer a variety of check-in calls, and one program that's helpful is called Are You Okay? And that's where we can check in with individuals at the same time every day, Monday through Friday, to make sure that they're doing all right. So that's especially helpful if they don't have family members that live in the area, or maybe not able to check in on them on a regular basis. We can help with that part and then notify you if there's a concern that comes up. Our Seniors A Go-Go program provides rides through volunteer drivers. Our care coordination program has social workers involved, as well as a variety of volunteer services to help older adults continue aging in place successfully. Our housing services team helps with navigating the affordable housing options, providing support to low-income senior buildings, as well as facilitating a roommate matching program called Home Share. And then our family caregiver support is where these webinars come through. So we want to provide resources and information to family members who might be worried about an aging loved one or might be providing direct services. So there's kind of that whole array of individuals who might benefit from learning more, and it can often be overwhelming. So we try to find topics that can be helpful and that you can easily follow up with if you need additional support. We record our webinars, so all of them are available on our website. If you miss one, you want to follow up, you want to check it out again, you're welcome to go to the Family Caregiver page on our website, and our webinar library is accessible on the right-hand side, and you can watch those again. So feel free to check out other topics that we've covered. We've also created online courses for family members who are looking for different educational information about what it means to be a family caregiver, also helpful assessment tools, and how to create a care team. So I encourage anybody to check that out. That is also available through our Family Caregiver page, and those are self-paced tutorials that are accessible at no cost. So feel free to check those out. We are grateful for the partnerships that we have with other local organizations that are reaching and supporting family caregivers. So in the area, Alzheimer's San Diego and Southern Caregiver Resource Center are a couple of other nonprofits that do great work in our community. So now I have the pleasure of introducing our speaker, and you know, financial costs are definitely a huge concern of a lot of people, especially when they're caring for a loved one and trying to plan ahead. So this topic I'm really excited to be able to bring to all of you, and hope that you'll find some helpful information that will help you in that process. So in order for us to do that, I would like to properly introduce our speaker, Tiffany Zhang. She joined the AARP team in November of 2020 and currently serves as the Program and Community Engagement Analyst in San Diego. She manages the operations at the AARP Information Center, leads the community events and education teams, and manages the metro area volunteers to strengthen local, multicultural, and member engagement. Tiffany also serves as the staff liaison to the California Executive Council, which is the team of leadership volunteers who help advise and carry out AARP's vision, mission, and strategic priorities. Tiffany's previous experience working in the community as a grant writer for a community health center, a volunteer coordinator for a local nonprofit, and a health educator for cardiac health and immunization clinics. She was also a former AARP community intern who supported AARP's strategic priorities, the San Diego volunteer team, and helped advance our age-friendly work in San Diego County. She's earned her bachelor's degree in behavioral neuroscience with honors and minors in communication studies and leadership studies at the University of San Diego. Wow, quite impressive, Tiffany. She has currently completed coursework for a master's in public health with an emphasis in health management and policy at San Diego State University. So quite a lot of experience there, and I have the pleasure of seeing Tiffany out at different groups that we both participate in for the greater good of the community. So welcome, Tiffany. We're so happy to have you here.
Thank you so much, Carrie. I don't think I've ever actually heard that bio read out loud, so that was really neat. So thank you. I'm like feeling, bashful now. So I appreciate it. And just thank you for this opportunity to get to present and share, hopefully, a really relevant resource for you all. Like you mentioned, there's a lot of different things. Hopefully, we can set it up into one practical guide for you all to work through and have on hand. So just appreciate this opportunity to share with everyone here today. So thank you, Carrie, and thank you for the great work that ElderHelp is doing.
Yes, of course.
Thank you, sir. As Carrie mentioned, my name is Tiffany Jong, and I am your local staff member here with AARP. One thing I did want to note is we do have an information center in North Park on 30th Street. So if you ever want some of these materials, like a physical copy, you can always come into our office and we have all of them on hand, or stop by and say hi and ask any questions. But if you could please click that link in the chat, the first one, if you don't have it already, to see the downloadable guide, it'll be really helpful because I'll reference some of the pieces there. You don't need to fill it all out during this presentation. It's something that could take you maybe one day to do, or you might want to break it up over a couple of days or get your care team together and figure it out. But it's just a good resource to take the time to complete so you can have on hand. Because, we know caring for a loved one isn't always easy. But in this session, we're going to introduce some of the essential information caregivers need to more easily manage some of the complex responsibilities of caregiving. So it's our hope that this will be educational and informative, and that you'll leave here today with more confidence in making your own plans, as well as a better understanding on how to plan for your care recipient. Before we officially go through the whole presentation, I always have to make this disclaimer, which is that this presentation is intended to provide general guidance. It's not specific legal or financial advice. Individual circumstances may differ and should be taken into consideration before acting. I'm not a financial expert, and I cannot provide specific advice or recommendations, but really hoping the information that we covered today will help you make informed decisions about your financial future. And of course, be sure to consult a professional for advice regarding your personal situation. So thank you. We just always have to cover that. And let's get started with the content today. Oh, I'm learning this new system. So let me go back 2 slides because I think we skipped around there. Okay. Sorry, Carrie, I'm figuring out this GoToWebinar. Here we go. So being a caregiver is a labor of love that comes with a lot of responsibilities, right? And we know it's kind of hard to put that price on caring, but it does often come with a lot of real out-of-pocket costs for you, because it may start with, getting groceries or maybe helping out with some housework, and then maybe making those trips to the doctor or the pharmacy, getting those prescriptions, and all those little costs add up, right? And having a clear picture of what's involved, whether it's health, housing, or finances, lets you plan ahead and make this juggling act a little easier. And that's why we've developed this financial workbook for family caregivers. It was actually designed to help you focus on the financial aspects of your caregiving journey. Also, why there's that funny pun of making sense of your caregiving responsibilities. And we hope that these tools will help you feel prepared to minimize the stress that making financial decisions can cause. And we will be using care recipient and loved one interchangeably, because we know that a lot of people describe their loved one that they're providing care for as a loved one or care recipient, but it'll be used interchangeably. So let me get this right for skipping to the next slide. There we go. So we're going to cover a lot of ground today. We're going to essentially go through the financial workbook, and then we'll talk about how to incorporate practical financial tips into your caregiving work, and then we'll add any resources to assist you with caregiving. So thank you, Carrie, for sending the guide in advance. I also want to note the second link in the chat is where you can request a physical copy mailed to you as well. It might take some time because we have to process it and get it shipped out, but that's just an option there. And then, of course, feel free to put your questions into the chat and we'll address them all at the end. So that's our agenda for today. So let's dive right in with some fun trivia questions to set the tone. A lot of people call family caregivers an invisible army, but without adequate support, they can be vulnerable to financial and job-related hardships, as well as a lot of emotional stress. So let's see if you can guess some of the out-of-pocket costs associated with family caregivers. So in 2021, about how much did family caregivers spend on average on caregiving expenses, including transportation and home modifications? We have 3 options, either $5,242, $7,242, and $9,242. If you want to type your best guess into the chat, just helpful to see where you think we're at with the on average caregiving expenses.
Okay, let's see what's coming in. So B. It looks like B is the winner at this point. The 7,242.
Either y'all are really speaking to experience or you got my my survey results early, but you're correct. It is B, $7,242. So good guessing there. Or maybe that's actually what you're experiencing, and then we'll talk more about that. Continuing on our sort of survey questions, we'll go to the next question, which is, in 2017, how many hours do you think were spent by unpaid caregivers providing for their adult loved ones? I think it was 340 million hours, 3.4 billion hours, or 34 billion hours. And I know it's kind of weird to comprehend billions, but just give your best guess in the chat.
All right, we have a B, an A, a C.
Yeah, this one's just a really best guess. It's kind of hard to figure out unless you're like me, you're trying to do the math and you're like, maybe, yeah.
Looks like we're all across the board right now.
Okay. Thank you, Carrie, for
Sure.
relaying those. So, according to AARP's report on caregiving in the USA, an estimated 48 million family caregivers in the United States provided 34 billion hours of unpaid care to adult loved ones in 2017. So it's C, 34 billion hours, which is, to me, I can't even comprehend that number. And the reason why we're sharing this all with you, I don't want to scare you all, but what it means is that that's about $47 billion in unpaid care. If you were to add, the average $7,000 of costs, 48 million caregivers across the nation, and 34 billion hours, that's a significant amount of money in unpaid care that a lot of you probably in this room and then around San Diego County that we know are having to manage and figure out their financial costs associated with that unpaid care because they're not, a formal paid caregiver, but having to figure it out and juggle a lot of these challenges. So furthering that a little more, might be wondering what was all that money spent on, and it's more than 3 out of 4 caregivers reported that they incurred most of these as out-of-pocket costs. And how did they incur these expenses? You know, sometimes it's better to do that than professional home care costs because it can cost a lot more. So that's why a lot of family caregivers end up taking it as out-of-pocket costs for themselves. And it's interesting to see that most of the expenses go to household expenses, and that can be light housekeeping, meal preparation, or running errands. And that's about half the expenses. But if you were to do a home health aide, that might cost more and add up significantly overall. So strictly from a financial perspective, it can be more cost effective to provide care for a loved one yourself rather than hiring a professional if you're able to. And obviously, there's different layers to this that you have to think through. If you're able to, you have the time and the space and the capacity, and also if your loved one needs additional care, sometimes a professional is needed. But this is really just to go to show how much caregivers have to take on a lot of these costs. And really the financial impact of that all is showcased here. A lot of people end up having to dip into their retirement savings to help pay for these costs, or they may spend less on their own health care to pay for these costs. And then more than a third cut back on their own personal spending, right, to save money that they need to pay for loved ones' care. And I know I can't see you all, but I have a feeling, because I've seen this in community a lot, they're like, yes, that's me. We've heard stories. I had to use all my retirement savings to pay for a home health care aid, something like that, and it really adds up and things like that, and it can cause some stress. Additionally, some of you may also be working, and that can cause some challenges too. So about 3 in 5 caregivers, about 24 million people, have a paying job in addition to caregiving, and they may have to take off time from their job, reduce hours, or even quit jobs to accommodate these responsibilities. And that can have a financial effect as well in reducing some savings for yourself or lowering your Social Security benefits. So we know that it can be really challenging to figure out how do I need to balance it all. So hopefully I haven't scared you all too much. The hope is just to kind of give a realistic picture of what are some of the things you're dealing with. And then now we're going to move into the workbook so we can really set ourselves up for success and understand all the different factors that may be inherent to your situation, but what we can do to improve the situation now. So what are some of the steps that you can take for safeguarding your future and your finances? And that's planning, which brings us to the bulk of today's discussion, the financial workbook for family caregivers. So if you have it open right now, you'll see the first page says, Dear Family Caregiver. This guide was designed to help you on your caregiving journey, and it was created through AARP and actually a caregiver. Her name was Jessica Allen, for her husband who was injured in active duty in the military. She was also a financial advisor, and she noticed the huge toll caregiving was having on managing her husband's injury and then also everything with family. So they developed this tool to have a workbook so she could have one place where it was all there and she knew what her plan was. So that's where this all came out of. So a few points we want to highlight right off the bat is cost of caregiving is high, right? So most families can spend close to $8,000 per year caring for a loved one. And you'll see throughout the guide a little piggy bank symbol. We've added those in so we could specifically point out some tips that could assist you while caregiving. Also want to note, of course, every caregiving journey is unique. It isn't a one-size-fits-all workbook. The journey is yours, and we just need you to put your answers. There's no right answers. You don't need to be, thinking, oh, this is where I need to be right now. Just put the answers that are honest to your situation, and you may be able to finish this guide in a few days, today, whatever works best for you is what you do. And this presentation just wants to hit those highlights in helping you complete the guide at your own pace. So you're not going to go page by page here. And we also know, just want to be thoughtful about this, this is a really sensitive subject, right? Caregiving can be very stressful and it can be over a long period of time. So don't forget to take care of yourself, please, like both your mental and your physical health. It's that idea, right? You can't pour out with others if your cup is constantly depleted. So just make sure that you still find time and not feel guilty about it to also care for yourself. So hopefully, yes, you're listening to a webinar right now, but hopefully there's something you can do in this time to feel like you're taking care of yourself as well while you're learning, something that can hopefully help you in the future. So going through the book, we're going to focus on 4 categories: health, housing, money, and the future. And remember, personal finance is obviously personal for a reason. So just take the best picture for yourself on where your finances are and write them down. And after you complete the guide, it can be a key resource for you to equip someone to step in and assist your care recipient in the event of your absence. So that's what's really neat, right? You'll have it on hand. And let's say you actually have to be out of town for a week, someone else can look through the book or some trusted person and be able to know what we're thinking about, how do we stay within budget and things like that. So it's just a great tool to have on hand. And then again, we strongly suggest you seek assistance from professionals. Sounds like ElderHelp is a really great resource as well, and they have care navigation as well. So for example, something like power of attorney or your will or burial plans, really you need to seek the guidance of an attorney. Here we can start the conversation, but that's out of our hands after that. And then also if you have debt management plan, you might need a financial counselor for that. So we're just here to help you through the process, but we don't want to replace your trusted financial advisors in this work. So let's start with health. Oh, sorry. So this is pages 4 to 17, where you're going to begin documenting plans for the health care of your loved one. So we'll cover health, sickness, and even death. And these topics, obviously, want to be mindful that it's difficult to discuss, but it's vital to make the right plans for yourself and those you provide care for. So before you start filling out every section right now, you want to take the time to gather that key information to help you fill out this section. For example, before you complete the whole healthcare team section, you probably want to make sure you have all the current numbers from the doctor, the hospitals, and the pharmacies, so you're able to actually use it when you need it. Go into the next slide here. So with page 5, which is the healthcare plan, you want to answer some very important questions about the care your loved one receives. First, you probably want to know what health care plan they're on. Are they using Medicare, or are they using a different insurance plan, or maybe if they're a veteran, they're using the VA, or maybe they're on private insurance. There are so many possibilities, right, with healthcare coverage. So make sure you take the time to understand not only who the insurer is, if you have an HMO or PPO, but also what are the caps, some of the copays, the deductible, and then what coverage is available, right? So in case of emergency, you know what the costs might be. On the next page of the guide, you'll list health issues, medications, and accommodations. And this is really helpful to actually bring with you when you go to a doctor's appointment, so you can double check and make sure all the medications are correct and they're the ones that should be taken. Emergency contacts are a must for sure, who can step in for you with little notice. And hopefully you have more than one person on that emergency contact list just in case you can't be the first one there or anything else happens. So if you can think of any other details that you can add to this healthcare plan page that can help any medical staff with your care recipient, so for example, maybe they have allergies to certain medicine, you want to write that in there as well. maybe they have difficulty hearing or seeing, you'll probably want to make a note of that. If you're concerned maybe they have early onset dementia or maybe some memory loss, you want to make a note about that just so it gives the medical team a clear picture so they know how to best help and they're not having to re-ask all these questions in the heat of an emergency moment. Additionally, I really want to note that sometimes it may feel like you're alone in this process and you're having to manage all of that, but you're not. It's really sort of like a team sport. You want to make caregiving a team sport. So in this section, hopefully you can document all the necessary contact information, such as names, addresses, phone numbers, email addresses, and any websites for your care recipient's care team. And that would include you as the caregiver, right? You're kind of like the captain of the team, but it could also be the medical professionals that you use with crucial information about what they do. And then there could be, the different organizations or resources that you're using. But it's good to just have that list of who's on your team and who you can call on for help and who's helping you do the best you can to care for your loved one. And then again, having that tool is really helpful for you when you're in a medical situation, something like that. You can always refer to it and all the information in one place and who to call if you need additional help. Another thing I want to note that was something that I think an act that was passed nationally, but in California, it's called the California Hospital and Family Caregiver Law. It does require that when you get medical care, that caregivers are recognized when their loved ones go into the hospital. They are notified when the patient will be released and then given the instructions they need for continued care before their loved one returns home. And this is just because sometimes in the hospital, the person that you're caring for, they're just kind of sent off. This new law requires the caregiver to be notified and given the information. So this is under the CARE Act. And what's really neat, especially here in San Diego County, is we actually have an age-friendly ER system. So they're building more supports for older adults to make it a better experience because the hospital can be very daunting and scary. So if you want to know more about that, AARP does have these little business cards that you can put in your wallet that just says, I'm a caregiver. Here are the 3 things I get under the CARE Act to make sure I'm informed of my loved one's discharge plans. But the hospitals should also be informed of this. And if you are the designated caregiver, they should be giving you that information. But just good to know on hand as you're thinking through those situations. In the next slide, we'll talk about other members of your healthcare team. So for example, do you have health aides visit your home? Or maybe you have a secondary caregiver that steps in for you so you can take a break or go to the grocery store. Who can step in short notice? Are you a member of a church or a community-based club? Maybe one of those organizations or a member from that organization can help you out or drop off a warm meal or help do some grocery runs. Or maybe you have someone who you can chat with from time to time about the stresses of being a caregiver. It would be great to list all those people in this section of the guide, just so again, you know who's there to help you out on your team, because it's a team sport, you need that support. We'll provide you with more information on some resources that can assist you later in the presentation, but I just want to highlight 2 things that can really help when you do need to take a break. So respite care is a short break from regular caregiving duties. As we've said, caring for a loved one is stressful and it could, take a toll on your physical and mental health. So respite care is a short break and people are able to help out with some minor tasks while you can take a break. I know the county has some programs around that if you qualify as well, like IHSS and things like that. So look up in your area and see if there's respite care options or respite care hours. Adult daycare programs can also provide caregivers with a needed break while giving older adults a chance to socialize with others, which could help with some of the isolation and loneliness many experience. So check out the local area on aging, which is our County of San Diego AIS, Aging and Independent Services, and they can help you with some of those resources. Or we do have a few other organizations that provide adult daycare programs, if that's something that you can see being helpful for yourself as well. So next in the health section is the power of attorney, or POA, and it's a signed document in which a person appoints someone else to act on his or her behalf. And I know this is where it gets a little daunting. We're talking about legal documents, but this really is helpful if you can do it in advance. It'll just save a lot of stress when you're in an emergency moment or a challenging time if you can do it now when it's a good time. They are sometimes limited to a particular purpose or period, and other times they're general. So just make sure, obviously, you have someone, an attorney, to be able to do it with you, or a legal, um, professional legal advisor to do it with you, just to make sure you're within the certain laws. But keep in mind, this guide only provides the power of attorney worksheet. It's not an actual power of attorney. It's just to tell you what to look for, but you need to actually seek a legal professional to complete a power of attorney, because they must be notarized in order for them to be binding. And there are some financial institutions and medical treatment facilities that require their own power of attorney. So sometimes they might not take a general power of attorney, but it is just good to start thinking through who is going to be the person acting on your loved one's behalf, and who's that designated person that you trust if it's not yourself. And if it's at the discretion, of every place to determine if they're going to accept your power of attorney. So just note that, and again, consult the legal professional to help you complete it. You can also name multiple people to act for you in a power of attorney, so it doesn't need to be just one. But personally, I think just to avoid some conflict, it's nice to have the one point person. But again, whatever works best for your situation. And it needs to be notarized like we talked about. So just make sure that you take the time to do that. Consult a legal professional. The worksheet in the book is just to help you get started on what questions are going to be asked and what you need to do to set up a power of attorney. But you'll need to do it with a professional to get it done. Also, just because this happened before, and hopefully this doesn't happen in your situation, make sure you know where you keep your power of attorney. Please keep the original somewhere that it can be protected from fire, theft, flood, or any other damage. You should also give a copy of this power of attorney to the person you are designating, in the power of attorney, so they know where it is as well. Because it is a legal document and it's a very valuable document, you don't want to not know where it is when you need it. So just a note there. The next thing to consider too, since we're diving into these big topics, is will and estate planning. And I want to be mindful, it is a very sensitive topic and it can be very emotional, going through this, but it's very important to make sure you can take the time to complete this section. We've heard stories from a lot of people that they were so grateful that this was set up in advance when their mom got sick and passed away, because it's answered a lot of questions and saved a lot of, conflict between the siblings, and any questions they had, they at least knew what was the next step. So it's really helpful to, if you can, set it up in advance. They can really be the voice for the person after their passing, and people reading these pages, of course, will be grieving the loss of the loved one, but having this information can really help them with that whole process. And if you take the time to list out what you want to happen, it takes all that guessing work out of the process and can really reduce stress and the grief process during a very difficult time already. So again, you need to, apply it to the person who's the family member and then the care recipient themselves separately. Um, you might be thinking to yourself that you don't have an estate. However, each one of us does have an estate. So you might just have a few bank accounts, a pet, and some material goods. But if the person that passes, all those things need to be settled. For example, like the pet, you don't think, but that sometimes can be a point of conflict on who gets the pet. So just make sure you can set the wishes for all those different pieces, even if it is a few bank accounts. Um, if you have minor children, you have to, I think, complete the will or estate planning as soon as possible, because there's some rules with, children in the certain ages. And again, consult a legal professional to figure out the best plan for creating that official will and or estate plan upon, passing. So just a note there. Um, just letting that sit in, because I know that's a lot of already, power of attorney and will and or estate planning. But just to continue on this topic around creating the plan, we have to dive into another very difficult yet necessary topic. It's important to make sure final wishes are known and documented. This can this will likely actually be a tumultuous time for your loved ones, and providing an interment plan will help ensure that wishes are carried out and will spare the family members from making a lot of difficult decisions. And I've heard from a lot of people they felt like they were able to honor their loved one better because they knew exactly what their wishes were. We've only included that one page in the guide for your care recipient, but it's good to add, what the you yourself as a caregiver, what your wishes might be as well, so you all are on the same plan. And to ensure the end of life plans will be carried out, you probably want to go through this list and see what you can set up in advance and meet with those, what location or service place you're going to use, or maybe a funeral home and things like that. They may also have additional resources that can be of help. Additionally, since we're talking about financial costs, end-of-life costs are the most important part to consider when deciding your burial plans. So you want to make sure that you have enough savings to cover any burial costs. And if not, is there life insurance that can help cover the costs? You don't want to leave the expenses kind of up in the air. So plan ahead. They can really help with this whole process. So I think that's all the kind of tougher topics we're going to cover for today in the workbook, but again, go through it to kind of get all those details down. And I think I just commented that those were the tougher comments, but I think us all living in San Diego, housing is also a pretty big topic that can impact our lives significantly. So we're going to dive into the next set of pages, which is 18 to 26 on housing. And it's going to cover obviously issues related to housing and then life at home for your care recipient, but we'll also talk about some transportation, which is incredibly important to think about with, helping your care recipient live in their home and community for as long as they choose, and for you to provide the best care you can for them. We'll also talk about some things like diet and allergies that can affect in the housing space, and then we'll rifle through the filing cabinet. So let's jump to the first part. This section is really intended to help you and your loved one get their home in order. If you live separately from your care recipient, you might want to take the time and fill out the pages for yourself as well. So you want to list any due dates, amounts due, and payments for like utilities or mortgages or things like that. You don't want to, miss or be late on a payment, and make sure you do this for all the bills in the home, even rental insurance, property taxes, and all utilities, so that you can figure out what billing and due dates you have. Budget billing is available with most utility companies and should be used when possible. Companies have different terms for budget billing, but they could call it bill averaging or a range of terms. And that's where a company takes 12 months of usage and then creates an average bill for you, so okay, on average, my SDG&E would be around this. I know it might fluctuate from month to month, but at least you can calculate what you'll need to have throughout the year to pay. And then you can also pay it that average amount rather than paying maybe, that crazy 300 one month and then 75 the next month. It'll just average it out for you, so it's a consistent bill. You can also ask for discounts. Don't be afraid to ask for discounts if you can. We all know with our phone bills, we kind of have to negotiate. They'll put you on a cheap plan and then they'll raise the prices again. Kind of got to talk to them and be like, hey, I'm going to leave unless you lower my bill, and there's some options there to get some discounts as well. The next part would be access to transportation, which can be an important factor in your care recipients remaining in your home. So think about, are they still able to operate, own, and drive their car? If so, you want to list all the resources to help with either making sure the vehicle is running safely, any other tools for the car. And if you don't want them driving, you might want to have that conversation about it not being the right fit to drive anymore, and what are some of the other options. Additionally, you might want to see what different discounts are available or tax exclusions. For example, sometimes you can lower the costs on your auto insurance if you take AARP's driver safety classes. Those are really popular, so different discounts that can help save some of the costs if driving's still in the picture. AARP Driver Safety also has classes on how you have that conversation to encourage your loved one to no longer drive if you don't feel it's safe anymore. Additionally, in the home, we'll probably want to consider any special diets or food allergies. So list all those out in that book. And this is helpful for you when you're making a shopping list, but also good for anyone who picks up the book if they know, oh no, they're allergic to peanuts. We might need to have an EpiPen on hand. And you also want to list the expiration date for the EpiPen and figure out what needs to be available and purchased frequently for things like that. So just list those out. We also want you to think through how to keep all your important documents secure. So you might want to consider getting a home safe and being able to put all your vital documents in there, or just anything that can withstand fire or that's waterproof, so you're not losing your safe documents. And additionally, we also have a file contents list in your book to help you get started on organizing your files, because you can have all your files, but if you don't know where each one is or what they do, then that's also going to make your life harder. So if you can go through and organize them, that would be really great, or make copies of it so you have a second set in case of accidental damage. Okay, so now we're going to talk about money. And we know that not only will you be planning and managing your own money, but also your care recipients. And home is where you tend to spend the majority of the time. So let's try to make your home a low stress environment. So that way when you're working through discussing money, it doesn't have to be extra stressful when you're at home trying to manage all these different things. So if you can set aside a space where you manage all your money and reduce the stress of it, that would be great. And you really want to see how you can make your dollars work for you and create that peace of mind. So we're going to talk about budgets, investments, and debts. So the first page on 27 will be the budget, and that's where you just want to honestly give every dollar where you're going and tracking the dollars actually, so you know where the money's going. And I'm sure you may have heard a budget talk before. We know that this list is just to help you get started on creating a budget. There's a lot of great tools out there too, but just make sure you're tracking where the money's actually going, and that'll help you see maybe where money that you didn't realize you're spending a lot on eating out or something like that may be affecting your budget. The point is to achieve a zero-based budget. That means you have $0 left after you give every dollar a name, and that means including your savings, right? It's not to just be like, oh, you need to spend all your money, but it's like, I've already allotted this amount of percentage to savings, this a lot to my sinking fund, and this amount for any care costs, things like that. So just make sure you can account for every dollar that you're bringing in and where it's going. So that's a quick budget talk. The next is obviously you need to consider the caregiving budget because there are specific expenses related to caregiving that wouldn't be in your typical budget. So just use that next page to go through some of the specifics on what your caregiving costs might be. Remember, unless your care recipient, is your partner and you're doing a combined budget, you'll want to have a different budget specifically for the care recipient budget and then your own budget. So that way you know where, your costs are going and what you're allotting to help with the caregiving, and then also with the person receiving care, what their budget and they can pay for as well. The next comment is investments, and we know investments can be tricky. You need to not only have money to invest, but you also need to decide your risk tolerance towards investing so you can determine where you should place your money. This is where a financial professional can come in handy and help you think through which investment companies are best for you, and make sure you know about what fees and commissions might come along with that. But it is just helpful in the way our market works in America. That's the way you can maybe make more income than a traditional savings account off of your existing money. AARP does have a tool called Interview an Advisor, and it just is a free resource to help you understand how to find the right financial advisor for you and to avoid anyone who may not be a legitimate advisor or maybe some kind of pyramid scheme or something like that. So check out the Interview an Advisor tool to help you get that conversation started around your needs there. The next page can be a tough one. It's the debt plan, and it provides you with a simple template so you can begin organizing your debts to create a get out of debt action plan. being in debt is not necessarily a bad thing. It happens a lot, right? When we are taking out payments for a house or a car or maybe student loans. The problem isn't the debt, it's the interest rates, right? So you may have had an original debt number, but it's gonna double or triple if you don't pay it off. So just be careful, because the debt system in America really is to favor the creditors, not us, the consumers. So trying to aim to be debt free, that can offer you some financial freedom and peace. There's different ways you can tackle it. Maybe you need a financial counselor to help with it, or some people do the debt snowball, which is they pay off the little debts first and then they keep building the momentum to work through to the larger debts, and that's what they call the debt snowball. Or figure out how you can make minimum payments so you're not getting those interest rates. Um, so AARP does have this tool called the Money Map, which can help you plan some of that out and how you could meet that debt number over an X amount of time and plan out how much you should be paying off at any given rate. So that was your quick financial planning coverage, but again, consult the guide. That'll help you figure out some of the tracking tools and budgets that you want to work through. And then again, financial advisor might be helpful, or there's a lot of great financial planning webinar that are for free on the internet. But really want to, because I know we're getting towards the end of our time here, is think through the future. What does the future look like for you? You know, what are your goals? Do you need additional education to achieve your goals? Maybe you want to continue through some of these new webinars, or maybe you want to go back and get your bachelor's degree so you can get a different job and help pay for some more of these costs. Or maybe you want to start planning for retirement and you need to save more for your retirement. And then think through how might caregiving responsibilities affect those plans. So really think through these questions on how you want to plan for your future, and be able to refer to your financial section to evaluate what some of these future options are for you. So just some questions to consider there. Now we're going to go through some of the resources available. There are a lot of great nonprofits in San Diego that help, similar to ElderHelp and ElderHelp, great resource. And then also you have your county's AAS and other government agencies that can assist you with your caregiving journey. We also have some pages in the book for you to write down additional resources that have helped you. Gonna go back. So AARP has, skipping too much, a few different resources for you. We also have this workbook in other languages, or one specific to the military and veteran community, because we know the VA has different support systems there. And then we have additional resources like our Caregiving Resource Center and support line that you can call in and ask questions. We also have a caregiving plan where you can create your action plan for caregiving. This one's the companion on the financial workbook for the caregiving plan. And then of course, there are some local resources. For example, there's communityresourcefinder.org where you can look up with your zip code and it'll tell you all the programs around that area, whether it be support groups or daycare programs or things like that. And then AARP does have a Family Caregivers discussion group on Facebook that's moderated. That's been really helpful. I'm actually a part of it. And it's just neat for people to share stories that have worked for them or different tactics that have benefited them when they're caring for their loved one or their parents. So with that, I'm just going to quickly recap all the topics that we covered today, because I know it was a lot. We started with health. You know, you're on a team. What are all those different information that you have to get listed? Who are the people you can call? What are your coverage options? Talked about housing. What are things within the home you want to plan ahead for? How do you make the home comfortable to age in place in? Things like that. And then we talked about money, you know, budgeting, getting out of debt, and then planning for the future. And some of those questions you want to consider to be realistic. What are my current options based on where I'm at financially? What are the wishes of my loved one? And how can that help with my own future plan and things like that? There are also additional resources that can support you. And I hope that this doesn't end here and you continue to work through the workbook. You have that on hand, but also access other resources and webinar to continue to learn and grow. We know this is sometimes there's a lot of different moving parts. So thank you for taking the time today to think through some of these tools, and hopefully you utilize the guide to create a one-stop place for a lot of this information when you're trying to make sense of caregiving. So with that, I'm going to open it up for any questions. I think Carrie's gonna share them, and then we also have some other online programs coming up soon if you're interested in. The one here that I'm really excited about, Reengaging Post-Pandemic, is going to be hosted by a NASA scientist, and he's going to talk about how astronauts who are isolated in space, what they do to keep their health up while they're isolated in that space, and what that looks like when we were all isolated during the pandemic. So thank you all for attending.
Thank you so much, Tiffany. That does sound like a very interesting topic. Very good. Well, that was a lot of helpful information and some great tips and resources were shared. So thank you for going through all of that. I love that all of you now have the workbook, whether you downloaded it or you're going to request a hard copy version, but that way you can take today's webinar and kind of start that off and see how you can complete the workbook for your own family. So I think that was a really good way to set the stage and to start those topics. So thank you so much, Tiffany, for that. Let me go to, let's see. I was just gonna flip through a couple of slides and then we'll ask some questions. This is Tiffany's information and AARP, and I'll be sure to share some of the resources as well in the follow-up email that she included. So keep an eye out for that. I think that will be helpful. And I will wait to see if there's other specific questions that come in. So feel free to type those in and we're happy to go through those. I know one question came in while you were speaking, and it was in regards to the caregiver cards that you mentioned when somebody is in the hospital or going to be discharged, and you mentioned that AARP is able to provide those cards. How would somebody go about getting access to those?
I will share the link in the chat. Is that possible?
Yeah, give it a try. If not, if you just send me the link, I can include that in the follow-up email as well.
Okay, that'd be great.
Okay, and that I think is something that's really helpful. I know there's so many times when people are having their loved ones in the hospital and not sure what the next step might be. And so having that kind of advocacy card to be able to say, these are my rights and this is what information I should be able to expect from you in that discharge planning process, I think is really cool. So I would definitely be interested in passing that along. So I will share that as well with everybody. I don't see other questions come in. They might be typing, so I'm gonna move forward while we see if there is anything. So just for ElderHelp, stay tuned for March information about upcoming webinars. We do have one scheduled for April, and that will be in partnership with Alzheimer's San Diego on the topic of safety at home. So some safety tips, especially for those that are caring for a loved one living with dementia. There's some specific safety ways that we can keep everybody at home and living more successfully. All right, and it looks like there is a question about if a loved one will require medical help from long-term care. Where can this person find out about that and for qualifying?
So that really, I think, depends on what kind of long-term care you're looking at, right? Because there's more work about long-term care insurance and how effective it's actually going to be. And then also the County of San Diego Aging Independent Services, they have a help center and they can let you know what support services are, whether it be their, they have care navigation there, or they have respite care services, or different programs as well. But I think the County of San Diego is a great resource for that. Carrie, can you send out the link to the AIS?
Yeah, I can definitely include that in the follow-up as well. That way everybody has everything in one place. I think that will be helpful. Our Aging and Independent Services is a great resource for anybody to look for different options that might be available within our county. So yes, I will definitely include that, no problem.
Thank you.
Yes, of course. I don't see any other questions coming in. I think everybody's digesting the information and figuring out how to take their next step. So if I get anything after the webinar, I'll definitely be sure to pass that along or send you those questions. But I think for now, people have a great way to start looking at all of those different aspects and try to complete that workbook. And I love that there's a follow-up workbook that they can also look at to create the care plan. So I think both of those tools are really helpful, and I'll be sure to include those links in the follow-up for everybody also.
Yeah, I appreciate that. I know it's a lot of content, and I hope that you all aren't too overwhelmed. Just take it step by step, right? You don't need to finish it today, but you'll feel a lot better when you have one place where all your information is. But I know it's a lot of content.
No, it's all important though. I mean, there's so many different aspects and involved with the financial side of caregiving and looking at your own finances and your loved one's finances as well. So I think you covered a lot of great information. It was very comprehensive. So thank you for that. I know it was helpful. So we'll end today's webinar, and I just appreciate everybody joining today, and hopefully you learned something new and you can get started for your own planning. And Tiffany, thank you again for taking the time to be here and to share your expertise. That was a lot of really helpful information.
Yeah, thank you so much for having us.
Sure, of course. Everybody take care, and I'll send a follow-up email shortly.